for today class, we will be seeing about the tele-oncology and telecardiology. So when you talk about the telemedicine applications, so we have like the several applications point of view. That's what I was saying. So the tele-oncology, so which is going to deliver the clinical oncology services to the patients. Okay, so when the patient is staying in the home, so we will be you will be using the technology. So using this technology, we will be getting as a the patient information, so the patient clinical information. So through the clinical information, the diagnosis will takes place. Then once the diagnosis in the remote locations takes place, then will be the processing like a treatment, and they planning for the follow-up practice at the distance. Okay, so the patients will be in the remote locations. So using this technology, so the clinical diagnosis takes place, treatment as well as the follow-up practice will be at the distance. So when you talk about this, the oncology is one of the important area we need to focus, because the cancer is one of the second leading cause of the death worldwide. So there are a lot of research is happening in that area. So this already I told you that telemedicine application. So this is the application for the cancer care. So we need to provide through the telemedicine services. So we'll be ensuring that the patients affected by with the cancer. So we are going to provide the service. So that is nothing but the tele-oncology. So when you talk about the cancers, there are several types of cancers. It's occurs. Okay, so that depends on the situation. So depends on the different types of cancers. So the tele-oncology service can be slightly, the modifications can be done. So the modification in the sense, the whatever the clinical informations you want to acquire from the patients, so you want to get from the patients. So slight modifications, you need to include the sophisticated instruments, equipments, biomedical equipments with that. Okay. So when you talk about the oncology services, so we need to have when you are looking for the oncology, tele-oncology services. So yeah, where we can use, why we are bringing the tele-oncology systems, because already I told you we are connecting the patients with the remote locations. When the patient is connected from the remote locations, so you are reducing the travel burden to the patients. So reduced travel burden to the patients, as well as when the patient wants to travel from the remote location with the referral centers and all those things. So there are huge cost involvement, as well as the appointment referral times, to meet the doctors. So the delay time. So sometimes they'll be looking for some kind of test process and all those things. So the patients has to wait. So there will be huge delay will be taken here. Okay. So sometimes the patients also have consultation, online consultations with the remote clinics and all those. So when you look for this tele-oncology systems, so we can say that a comprehensive system for the management of cancers at the state level as well as the national level. So already I told you in the previous classes also, like the, the local authority, state level, and national level. So we can have the entire the cancer management in the state level stats as well as the national levels. So when you are bringing this tele-oncology to connect with the rural people and all those things, so we can have like a kind of options. So to detect the cancers at the earlier stage. So if you are detecting the cancer at the earlier stage, so the patients can be get the early treatment for the cancer patients and all this. So we can have like a kind of awareness systems. So this awareness will be created around the public. So public awareness can be the kind of programs can be conducted through the tele-oncology systems. So when you look for the tele-oncology systems, the local patients, so they will be very comfortable with the local appointments and all those things. So okay, so when you are practicing this kind of tele-oncology systems and all those things, so we need to create the kind of training program. So through the training program, so you can improvise the rural or local staff skill development. So how they will be involving into the particular programs and all those things. Okay, so this is also the advantage of the system. So we can have like we can widen the scope of its applications through the tele-education, through the creating the awareness and all those training programs. So this is where the tele-oncology consulting would be helpful. So when you look for that, so when you are looking for how this tele-oncology system is going to work, so we need to establish the video conferencing setup. So both the end, so both the sites should have the remote as well as the referral centers should have, or you could say as a nodal center as well as a referral center. Each site should have the video conferencing setup. So when you have the video conferencing setup, so you'll be looking for the appointments. The patients will be looking for the appointments time. So when you are giving the appointments, so you'll be blocking the date as well as the time. So from the particular city center. So with the patients, those who are visiting there, then the local centers with that. Okay. So the time allotment for the particular date is blocked by the patients. Okay. So when you're looking for the appointments, the patient has to visit the local centers. So once if they are blocking the date and time, so they can come for the video conferencing facility as well as the accessing the equipment. So because when the patient is visiting the center, they need to get the all the signals, the physiological information, data, patient information is very, very important, right? So they'll be collecting the several signals as well as medical information, we can say. So already we know that the medical information, it can be a voice, it can be data, it can be the image, it can be moving images and others. Okay, so the explanation as well as a consent by the local centers, because so when they perform if they come for the tele-oncology services, they need to explain the procedures and all those things. Another important thing is they need to get the consent form. So the consent is very, very important before perform any application in telemedicine service. Not only in the telemedicine services, so then they will be freezing the next appointments and all those things whenever it's needed. So when you look for this kind of information, so we have like the data flow model for the tele-oncology process. So we have the three different set the classifications. One is the immediate, another one is advanced, and synchronized mode. So there are three modes are there. So it depends on the patient conditions, so which is required. So we'll be using that. So the first one is immediate. So whenever the patient is visiting to the remote site, so immediately establishing the real-time conference with the main site. So all the informations will be displayed from the remote site. So it's a kind of real-time process, we can say that. So it's a immediately the remote site will be connected with the main site. One is another classification methods we have, like advanced one. So when you when you are looking for the advanced one, so the patient will be visiting the remote site. So from the remote site, all the information, so it's like the lab results, images, all those things will be transferred either in the hard copy or soft copy to the main site. So from the main site, So from the main side, so they will be establishing the real-time conference towards the remote side. So the real time conference is established from the main side to the remote side. So this is the advanced. So here all the information is shared, so through the hard copy or the soft copy. So all the images, lab results, all the clinical results, all those things can be shared and advanced. So the clinicians will be having the informations. They will be analyzing, then they will be communicating to the establishing the connection with the remote server. The another next method is the synchronized one. So the synchronized one, if you understand, it's a bidirectional. So it's a kind of um, both the way that we have like a connection. So the half duplex, full duplex you would have studied. So here the we can say as a full duplex, both the way. So we have like a connection established between the remote site as well as the main site in the sync using the synchronization software. So we are establishing the real-time conference. So whenever the conference is established with the time, so the all the images, whatever it's taken, it's sent through the phone line few minutes before the come. So it is with the all the information will be shared from the remote side to the main side. So the conference is established with the on time with the. So these are the three different classifications teleoncology process. So how the data flow takes place. So whether it's a immediate or it's advanced or it's a synchronized. So this three criteria you need to do. Any teleoncology systems will have any one of this method can be picked for the process. So when you look for the teleoncology process, we have like benefits as well as disadvantages. When you look for them, we have categorized. So the categories of the users. So from the patients as well as the telehealth teams, including the physician and the nurses, we can say as healthcare professions. So here, another category we have like a healthcare providers and the stakeholders. So any organizations, any services, the stakeholders also it's one of the important. So we have like the benefits as well as disadvantages. So as per the patient concerns, if we see if they are coming for the tele-oncology process and all those things, services, so they definitely will get the improved access to the physician. So because they will be connecting with the physicians whenever they want to discuss with the physician, as well as the travel time is reduced here. So that means decreased distance because they are not traveling to see the physicians. So the travel time is reduced, cost also reduced. So when they want to visit the doctor, so the amount of dedicated towards from the work, so it can be reduced lesser time. So they can access all the systems, the informations and all those things, so that they can look for the proper scheduling. So all the things can be taken here. Okay. So the potential disadvantages we have with the depersonalization stress of technology, because if see everybody is we can't assure that everybody is good in the technology. So sometimes through the connecting the online appointments and all this, patients may get the stress of technologies and all those things. So definitely it's not a hands-on kind of thing. Okay, so the physical exams will not happen in that um, in all the times. So the lack of physical examinations will be there. So through the reports, whatever we are setting, that can be considered here. Similarly, when you look for them, the healthcare professionals and all the things, so the doctors also decrease the need of for the travels. So they can have like an increased safety level. So they can look the work time, so it can be optimized with the work. So they can look for them kind of further the involvement in the productivity, increasing the productivity and all those things. So educational point of view, they can give the lot of the training program to the peer teams and other things, so they can look for the kind of collaborative opportunities and other things. So this are all because once if you are establishing the systems, so you'll be connecting with the several peer teams and all those things. So again, we have some disadvantages for the healthcare professionals like scheduling problems, depersonalizations, sometimes increased clinical risk. So how the legal implications can be taken here. So very important thing is the reimbursement issues, how this can be taken. So all the data, medical information will be transferred to the doctors. How, what is the confidentiality issues and others. Because over the medium when you are discussing, it should be confidentiality should be maintained. So similarly, we have like other healthcare providers as well as stakeholders. We have like advantages. We can speed up the medical process and all those things. So we can have like the unnecessary reference can be reduced. So the once the test is taken, if you're going for the second consultations and all those things, there is no need to unnecessary test. So the procedures, so everything we can say as a advantages. But we have like a disadvantages. So when you want to establish this kind of systems on teleoncology sites with the remote site as well as main site, so we need to have the as a stakeholders, we need to have the cost involvement. So the its initial cost is very high. So whether efficiency related problems, all those things will comes because we need to establish with the initial cost and all those things. So these are all the potential benefits as well as the disadvantages when you are establishing with this. So the teleoncology in India, so they started the implementation in India on Connect. So in Kerala, they initiated that. It's collaborative with the DIT, CDAC as well as RCC regional cancer centers, Trivandrum. Okay, so they started with uh, regional cancer centers, which is connected with the other peripheral centers. So that's what we are going to see the examples here. So how they are connected. So when they connected with that, so they started with the high bandwidth connectivity. So they established so through the VSAT terminals, very small aperture terminals um, by the ISRO. So when you talk about this, this is the centers we have regional cancer centers. So from the regional cancer centers, so we can consider as a specialty centers. So another one we have like a nodal centers. Okay, so when you look for this nodal centers, so we'll be getting as all the information. So from the centers, we'll be sharing the all the informations here. So when you look for this. And the nodal centers. So we will be having the telepathology, teleradiology, and to establish the telemedicine services with dedicated PC. Then the video conferencing facilities we have in the nodal centers, which is connected through the switches with the network connectivity. On the specialty centers, we have like a servers. So like a teleradiology server, pathology servers. So we have like a digital library. So we have the telemedicine service. Then we have like a hospital information system. So HIS, which is connected to the local area network. Then we have the telemedicine PCs and video conferencing systems. So when you have this kind of facilities from the specialty center and nodal centers, so whenever this information is needed, it can be transferred. So all the informations the hospital information systems is integrated with that. So whenever we need with that, so we can connect with it. So all those things will be connected with the and stored into the servers. So when you're looking for the server establishment, so we'll be looking for the when the needed information. So whenever it's needed, so you'll be looking for that. So through the own connect platform, so we'll be connecting with it. So all the systems whatever we are using, so the information is connected with the standards adopted HL7s and others will be. So when you look for the tele-oncology infrastructures, we need to have the RCC, that's one specialty centers we can say. Then we have the nodal centers. So in the specialty centers, we need to have the connectivity, video conferences. Already I told you, right? Telepathology, radiology, everything should be there. So we need to establish in the server for the telemedicine applications in the RCC. But in the nodal center, there is no need of any server systems here. When you look for the central hub locations, so we need to connect with the MCCU. So the multi control units we need to have. We need to have the video processing servers. We need to have the national web portals. So through the web portals, we can get all the information. Similarly, we need to have the digital library as well as a high bandwidth connectivity we need to establish. So this is the tele-oncology infrastructure. So when you want to establish with the specialty centers and nodal centers and the central hub locations with that. So when you look for the tele-oncology web portals, so this can be updated so that the stats can be taken on the national wise. So similarly, we need to have the kind of establishment in the oncology resource centers, so the digital library. So this will have the entire information now in the pandemic. So how the portal to get the information about the COVID and all those things. So like that, so we need to have the oncology resource centers. In that resource centers, we will be having all the information related to the cancers. So about the clinicians, researchers who is working. So what is the health planners, administrators. So all informations will be. So those who are involved in that, so the involvement in the network hospitals, everything can be taken here. So this is another important the source or resource for the like a digital library we can say. Okay. So followed by we can say that the Sanjeevani. So it's the first tele-oncology unit in India. So in the collaboration with the Malabar Cancer Society as with the ISRO and the CDAC team. So you can see that this is the vehicle which is will be traveling to the rural locations and all those things. So they will be taking the consultations. Okay, so this is for your reference. So the another area we for the telemedical applications, telecardiology. So the telecardiology is the practice of cardiology which uses the telecommunication technologies and all those. So using the technology, so we'll be getting as a about the patient information. So which once if you get the medical information about the patients, so we'll be establishing the real-time discussions with the patients. So that sometimes the general physicians will be discussing with the cardiologist and other things. So this telecardiology will give you this options. So if the doctor, the patient is visiting in the rural locations, to the general physician, if the general physician wants to establish the connection to the cardiologist, so they can establish and they can get the real-time discussions and all those things, so that it can be treated. So all the people will be getting the treatment whenever it's needed. So there are a lot of telecardiology systems we have. So we will be using the various options, telecommunication options and all those. So here also we will be having some clinical information. So when you are sending the clinical information, so we will be adapting the compression techniques and all those. So all the informations, medical informations will be transferred from the one location to the another location. So when you are transferring with that remote site to the main site, So you'll be getting all the information with the main site, so that so you'll be looking for the some kind of analysis and all those things. So when you look for the analysis point of view, so the test and the analysis, so it will be done. So the patients will be getting all the facilities. So with the very cost-effective methods and all those things. So with the cost-effective methods, they can get the cardiac care whenever who need it. Okay, so that is very very important thing. So when you look for the telecardiology system, so in the Narayana Irudurale Bangalore, so they initiated the telecardiology service between the Narayana hospitals in India. So they in the cardiac centers, they established one cardiac centers. So with that, so they will be connecting with the different countries, so like Malaysia, Bangladesh. So they are providing the cardiac care in the affordable range. Okay, so here they will, this is one of the example we are who are working on the cardiology, that telecardiology. So they will be looking for the remote diagnosis. So with the after the preliminary test as whatever the conducted. So they will be looking for the treatments for the patients, as well as if the patients require any kind of surgeries. So they will be looking for that. So then they will be looking for the follow-up treatments in the patients in the home country and all this. They establish the telecardiology systems in and around Bangalore. So they connected with the through villages and all those things. So they will be giving kind of follow-up checkup as well as the treatments and all those things. Within India, there's the program also extended through the post office, because so we need to establish the telemedicine. When you want to establish this, we need to have the both the sides should have the video conferencing systems and everything. So so in that aspects, if you are establishing, so we can connect with each and every rural villages. That is ultimate. So when you talk about the telecardiology systems, so the another one work is done in the University of Calcutta. So they developed the portable diagnostic telecardiology systems. So which is used to connect with the people in the rural villages and all this. So the system has two major blocks. So the first one will be carried to the patient home. So it's a kind of a portable telecardiology kit. So this kit will be taken to the patient home. So the second one is the automated cardiac signal processors, so the PC-based systems. So this can be kept in the rural centers, the primary health centers, rural health centers. So primary health centers anywhere it can be kept in the permanent. So this portable telecardiology kit will have all the basic signal acquisitions. Like when you talk about the telecardiology, we require the ECG, electrocardiogram. We need to have, so the ECG waveform, to acquire the ECG waveform, we need to portable ECG machines. So that can be connected with that. So with the associated with the kit. So this can be taken to the as a portable kit to the home and all those things. So the several microcontrollers options will be enabling to have the establish the communications and all those things. So it can be taken to the patient home. So once it's the kit is connected, taken, and it's a portable device, right? So we have like so the ECG signal acquisitions can be done in the patient end, so in the home. So when you look for the ECG signals, so it can convert along with the tag pages and all those things. So all the information regarding the patient, the history and all those things can be taken with that. So with the tag, so afterwards the information, the signals can be digitized with the and it can be transferred. So when you are transferring the signal, so it can be the you kept in the rural center, right? So it's almost over the distance of 7 to 10 kilometers through the any wireless medium and all those things, it can be done. Once this information is transferred to the PC based systems, which we have in the kit, so we'll be having the information. So from the patient side, so we'll be sending the ECG signals and all those things. So when you're looking for the this signals, so you'll be once if you have the signals, you'll be looking for the several processing of signals and all those things. So then it can be taken into the database systems. Once the information is taken, so that can be taken for the decision support systems and all those things. So we can connect with that. So with that information, so we can get the kind of reports and all those things. So that can be say example, if the signal ECG signal abnormalities are there, so based on that, so that report can be generated. So this can be taken with the further analysis. So the system we have here will be generating the report. So whatever the preliminary studies, so any abnormalities are there and others. So this is an entire thing. So with that, so this is the example. You can see that the information. So how this is the example is given cardiovascular what we have. So here the ECG acquisitions takes place. So when the ECG acquisitions taking place, acquiring the signals, so that can be connected with that. So we have like in the cardiovascular ward, we have the nursing stations, first aid and others. So the informations, the signals, medical informations will be transferred through the portable device and through the Wi-Fi systems. So once it is connected with that, so similarly we are establishing the hospital intranet connectivity. So with intranet connectivity, so we will be establishing the emergency ward as well as the hospital information data provider. So once the data is taken, the medical information, the signal is acquired, so that has to be stored in the database also. So whether if you have the data, so the data can be taken with that. So that will be taken to the for the referral doctors and all those things. So they'll be taking with that. So whenever it's the abnormal data and all those things takes place, so immediately the alert missions will be given. So the abnormalities are there, so kindly take care of the procedures and treatment procedures. So the entire information will be shared here. So this is another system model, you can say that. So we have starting from the pulse oximeters, different sensors, ECG device, and the BP measurements and all those. So that can be connected with the cardiac patients at rural centers. Okay, so we have the cardiac pulmonary medical device. Through that, so we'll be sending the all the informations, the health records and all those things. So when you are sending the health records to the specialized hospital, so from the specialized hospital, so they will be storing a purpose hospital through in the hospital HIS hospital information system. All the informations about the patients will be stored here. So from the healthcare professionals, so they will be analyzing and they'll be giving us a kind of alert if the patient is in the about the patient conditions and other things. So the real time the patients will be getting a okay. So here you need to check that which cellular network what we are using, the 2G, 3G, 4G network. So when you are talking about the rural village and other things, so the possibilities of getting the 4G network is very less, okay, compared compared to the metropolitan cities and others. So that is the reason. So you can say that cardiac patients at the rural centers will be connected with the cardiac pulmonary medical devices. So the cardiac pulmonary medical devices will be establishing the communication systems. So when they want to establish the communications, so here we have like the switching, auto switching. So it will be connecting with the 2G, 3G, 4G network. So now, for example, our mobile network also, when you are in the 4G network and other thing, if sometimes only the 2G network is available, so it will change to the 2G. So auto switching will happen. So sometimes you will be freezing only the 4G, means only it is check for the 4G network. So if you are enabling the auto switching, so it can be taken. So similarly, we have like a satellite communications also for to the. So with this auto switching mode, so the all the medical information, the health information systems. So the EHR will be connected in the specialty hospital. So they'll be viewing with the information. So whatever the data it's sent um, from the rural centers. So they will be viewing the patient's records, and they will be giving the alert system. So this is the flow of the entire telecardiology system. So you can say that. So the next we can view that as a flow chart. So when the patient is in the emergency, so they will be looking for the through the satellite communications and other things, so any other networks immediately. So the important thing is the patient will be taken all the data, so the data will be stored in the memory, then the interpretations will take place. So they will be generating the EHR files and all those things. So if it is emergency, they will go for the satellite or any network. If it is no, they will be connecting through the whatever available network, 2G, 3G network. Then they will be looking for this. So when you look for this